Everybody. Thank you for joining us on this crisp autumn morning for Virtual Science Cafe, a tale of two women scientists turning passion into action. Just to lay out some ground rules, we are recording this event and it will be posted online after the event. I will also send a follow-up email to all registrants, which will include the recording as well as contact information for our speakers if you have any follow-up questions for them that you weren't able to ask at this event. My name is Brian McGonigal. I'm the manager of alumni community engagement for SEVS and the Experiment Station, in case you're wondering. Right now, I'm going to hand it over to Dr. Mary Nucci. She is the Assistant Dean of Campus Engagement here, and she's also the Director of the Science Cafe program. Mary, take it away.
Thank you, Brian. And you could tell everyone that it's getting close to the holidays because we're all so happy and forgetting all the things we normally do. So welcome everyone to the last of this semester's Science Cafes. We're very excited to have a slight change and focus on maybe not so much the science, but about the work that science can do when it's been successful. So I'm very honored to introduce Dr. Ariane Vasilatis and Dr. Eileen as founders and chief officers of a new drug discovery startup company founded by them as Rutgers alumnus called Zena Therapeutics. The mission is to develop safe and effective therapeutics for anxiety and addictive disorders to prevent polysubstance overdose fatalities and facilitate recovery from addiction. And I'm going to let them talk about themselves because that's just part of their discussion. So thank you so much. And I will turn the mic over to you too.
All right, let me just, Eileen, I'll share it.
Mm-hmm.
Okay. Oh, maybe. Okay, perfect.
Okay, excellent. Hi, I'm Eileen and I'm here with Dr. Ariane Vasilatis, and we're going to talk to you about how we turned our Rutgers innovation into a company. So next slide.
Oh, I'm so bad at this. I got it now.
So I'm founder and chief scientific officer of Zena Therapeutics. I graduated from Rutgers University in March of 2021. And my dissertation research was actually the foundation of our IP for Zena Therapeutics. And with that, I'll turn it over to Ariane.
Yeah, hi everyone, Ariane Vasilatis. I am the co-founder and chief executive officer of Zena. As Eileen mentioned, her thesis work actually laid the groundwork for Zena Therapeutics' innovation. And from here, we're going from benchtop to business. So as you can see below our names, we've been awarded a startup challenge from the National Institute of Drug Abuse, which came with entrepreneurial mentorship, as well as being fellows from the Yale Innovation Impact and National Science Foundation Innovation Core Fellows as well.
So as mentioned, we're a Rutgers University spin-off company, and our mission at Zena Therapeutics is to develop safe and effective treatments for anxiety, specifically for those with substance use disorder, with the aim of preventing overdose fatalities. So we'll go into this a little more. So next slide. Okay, so the problem. So risk of acute anxiolytic, and so we're aiming to mitigate the risk of current acute anxiolytic anti-anxiety medications and those for alcohol withdrawal symptoms. So currently the standard of care treatment are a class of medications called benzodiazepines, also known as Xanax, Valium, and they're associated with many risks. It's estimated that 17% of the population use benzodiazepines both legally and illegally, and about 5% have a prescription. So benzodiazepines, when mixed with other neurological depressants, such as opiates or alcohol, have really high risk of overdose. So they cause more than 12,000 overdose fatalities in the US alone. And this has become such a problem that in 2016, the FDA released a black box warning about the overdose risk with benzodiazepines and opiates or alcohol, and also the risk they pose of life-threatening withdrawal symptoms. because they can actually cause seizure. The withdrawal symptoms themselves can cause fatality. So it's a major problem. This is just really to demonstrate what a huge problem this is. It's really under-recognized, so we like to try to raise awareness. So multiple celebrities have died from the combination of, benzodiazepines with opiates. Usually the news articles just say fentanyl, but when you read closer, there's almost always benzodiazepines involved. And this is also, it can affect anyone. So this here is an example of an 18-year-old high school student who died from mixing benzodiazepines, Xanax specifically, with alcohol. And it's really under-recognized to the point where a lot of doctors don't fully realize the risks and are not always warning the patients of the risks.
Yeah, and just to add to that, in the previous slide, we mentioned that in 2016, the FDA released a warning about these effects and these dangers and risks. But benzodiazepines were discovered in the 1960s, so it's been over 4 decades of these risks and liabilities without recognition. And finally, since 2016, when the FDA released this warning, we've been gaining a little bit more traction. But Eileen and I have found, especially from speaking to physicians and to other people in the environment, that it's still a very under-recognized risk and area.
So I think I saw in the chat about asking whether this was something we wanted to work on before. And so this actually started with an idea I had before I began my work, my graduate studies at Rutgers University, from a study that was published of a natural product that had a really promising mechanism, which I thought would be, potentially for alcohol use disorder, which was the original target. But anyway, so this was a natural product that didn't have drug-like properties. And what this means is that it can't adequately be absorbed into the body, which is necessary for long-acting and robust efficacy. So during my dissertation research, and as I mentioned, this started as a side project. It's something I was very passionate about, having, my own personal experience and awareness of this problem, and really seeing the gap that that wasn't being filled to solve this problem. So that's really what motivated me. And during my dissertation research, we optimized this molecule further to discover a drug-like compound. So we are targeting GABA receptors. So GABA receptors are the major inhibitory neurotransmitter. It's alcohol also targets this receptor. So it's what really reduces your inhibitions. So we're targeting the same GABA receptor as benzodiazepines because we know it is really very effective it's really the only effective fast-acting treatment for anxiety and alcohol withdrawal. So we know this receptor works. So what we're doing is to reduce overdose risk is we're reducing the maximal response at the receptor. So what this means is we're creating a ceiling effect. So essentially with escalating dose, or no matter how much an individual takes of this medication, it will never rise past the level of mild sedation. So it won't get to the point of severe sedation and respiratory depression. And those are the major causes of overdose.
Yeah, and just to interject a little bit, so creating a ceiling effect has actually been shown to work in other pharmacotherapies on the market, namely buprenorphine, which is used for opiate use disorder, uses a similar mechanism. So we're also fairly certain that this mechanism can achieve the goals that we really want our innovation to pinpoint.
So the current status, as mentioned, we discovered a novel drug-like derivative of our original natural product, which it's currently protected by an international patent. This was filed by Rutgers University, and which myself and 2 of our founding members are inventors on. And we're currently in negotiations with Rutgers University to establish an exclusive license with Zena Therapeutics. So in rat models, we found that our compound demonstrated fast-acting anti-anxiety activity, as demonstrated by the elevated plus maze. And we also found preliminary results that suggest a lack of enhancement of alcohol-induced neurological depression. And this we were very excited about because this is a major problem with benzodiazepines, and really is what sets our scaffold of our derivatives apart, because it doesn't have that same interaction with alcohol. So the original natural product, why we selected it is because it was a GABA positive modulator and actually counteracted the effects of alcohol. So this really demonstrated like this is possible. You can have a positive modulator at this receptor without the interaction with alcohol, which benzodiazepines have like more than additive effect, which really increases accidents and overdose risks. So next milestones, we're currently in the discovery and optimization phase. We're synthesizing some more derivatives of our molecule and designing more preclinical studies. The ultimate aim is to select our clinical candidates for IND enabling studies and ultimately to bring to phase 1 clinical trials. So we were just going to discuss more broadly the approach that we use to get to where we are today. So our first step was find your problem. And as I mentioned, you know, for me, this was an issue that I was aware of and invested in, and Ariane as well. We both have our own personal experience. So, as mentioned, it's really important to have a problem you care about. You're going to be spending a ton of time on this. You have to be willing to basically give everything to this. So you have to really believe in it. You have to really care. It's a problem, like, so it really helps to have something you deeply want to solve, and something that you're passionate about doing, right? If you're passionate about something, if you love doing it, you're going to think about it more, you're going to end up doing it more, and you're naturally going to be better at it. So it's kind of like contrary. A lot of people think like you have to suffer to be good at something, but actually what you love doing, people tend to be best at. So, and yeah, sorry.
Oh, do you want me to go back?
No, it's good. Identify gaps with opportunities. So this is really important to identify the gaps in what hasn't been done. And one of the good places to start is when you can see a solution that would work, but it's not being done, and really question why it's not being done, because a lot of times don't just assume that the reasons that weren't pursued are still applicable today, because there might be new tools or new avenues around those roadblocks. So any problem really is not going to be in one field. It's going to be in multiple fields. So you really have to be prepared to go outside your field, collaborate, and really follow the science, not what you want to be true, but you have to really be open to follow the science to get to the right solution, and be persistent. Very important. So this is kind of the process we've developed of, which I think like everyone kind of uses, is learning through trial and error. And you have to get really comfortable with this, perhaps more in the entrepreneurship space, because you're really targeting a solution as quickly as possible. Time is extremely valuable. So you may have heard the phrase fail fast. So this is really important to continue. The more you try, the more likely you are to get to the solution, right? But you can't just keep trying. You have to also adapt fast. So you really have to learn to understand why it didn't work so that you can plan and move ahead. And there's many different methods of trying. Like initially you can start with thought experiments, the concept of imagining a potential solution and seeing like if that would work. And then you can do internet searches to really see, does this fit with what other people have done? What is, where have other people gone with this? And also discuss it with other peers to see what their input is. And then lastly, bench experiments. And really you want to design your trials to minimize the negative impact of your error, but maximize the utility of knowledge gained. So you want to really make sure you're learning from your mistakes.
Yeah. And just to reiterate, do not be, especially when you're looking, to become an entrepreneur or to move your innovation into a commercialized space, you really can't be afraid to fail. I mean, this is true in science. Eileen and I are both PhDs, so we've definitely gone through the trials and tribulations of failure and, multiple different experiments not working and things like that. And you just have to, accept the failure, understand why you failed, and just get right back up and try to solve it as best as you can. All right, so step 2, opportunity. Forgive me, everyone, I'm fighting the sun. I'm trying to not have a glare in my glasses, but it seems to not be working for me. Again, I apologize for being half in the shadow, half in the light. But so step 2 is opportunity. So what do we mean by opportunity? So the way our strategy, the way that Eileen and I kind of looked at it was to apply for every opportunity. We're at a major research university, so there's a lot of opportunities around us, especially in the areas when we're looking at small molecule development. There's many pharmaceuticals, and there's just a lot of things that you can take advantage of. So for example, like you will need, if you're developing your innovation further, you'll need grants for research and development. And that could be in the form of federal, private, perhaps a tech advance, and they all have their pros and cons. So for example, federal grants, you know, an R01 or what have you is incredibly competitive and takes forever to get an answer. So you could be waiting 6 months to a year to find out whether or not, you know, you have the funds to continue your research. And in that meantime, what are you doing? So, you know, you need to keep yourself busy even when you're waiting, because chances are you won't get every single grant you apply for. So you want to open a wide net to try to get anything that will further your research. And in addition to grants for your research and development, you should look into professional development programs. And these professional development programs can offer mentorship and entrepreneurship, and can also offer some stipends or some funding for research and development. So you should definitely take advantage of those when they appear. So for example, so for our university-based funding, so this is the funding that the innovation received through Rutgers University. We have an innovation grant that we received as Rutgers for phase 1 and phase 2 for innovation from New Jersey Health Foundation. We also applied to Department of Defense grants, which was $10.5 million, an R01, and they were sadly not funded. So this is another, you know, example of failure and trying again, right? So we didn't get, you know, that $10.5 million, but we did get $97,000. So that still counts for something, right? It still gets you, keeps you going to some effect. And then also, you know, something that ties in research and development and entrepreneurial or like personal development is Innovation Corps. So we did the Rutgers site, also now called the Northeast Hub I-Corps, which offers entrepreneurial mentorship and support. And then we did a second round of Innovation Corps, but this time the National Innovation Corps, and you receive a $50,000 grant with that. And that $50,000 is incredibly helpful, especially if you're going from science into entrepreneurship, because Eileen and I, you know, we don't have MBAs, we don't have a background in business, so we really did not understand the landscape to the, like, to the effects of, you know, someone who did have that background. So we used some of this grants award to go to different conferences, namely Bio Conference that was in San Diego this past June, to kind of see one, like, where is the technology at, like what are the new innovations coming out, and make warm connections with individuals who may be a couple steps behind us or a couple steps in front of us, and really, you know, become part of the community of entrepreneurship. So incredibly like invaluable experience for sure.
Yeah, I was just going to also mention New Jersey Health Foundation because they funded actually my dissertation research through an innovation grant. And that was like, you know, I had, as a student, I tried applying for, you know, NIH grants and, you know, like that weren't funded. It was very frustrating, but like at the same time, just applying is a success because you learn so much about the process. You usually get feedback. But also I was persistent, you know, and there are avenues where people, alternate avenues such as New Jersey Health Foundation that many students might not be aware of to fund research, especially something that is more innovative and entrepreneurial and something, you know, very passion driven. So.
Yeah, absolutely. So then, you know, because of those different opportunities we were able to receive, that kind of laid the groundwork that got us far enough in our innovation that we were able to apply to these different programs that we were accepted to and were awarded. First, from the National Institute of Drug Abuse, I think I had mentioned this before, the Start and Substance Use Disorder Startup Challenge. So this was both commercialization mentorship and a $10,000 grant that went directly to Zena Therapeutics. And this mentorship, though it is geared towards substance use disorder, there are others out there from the NIH that look at different areas, but this one is specifically substance use disorder. The part of the commercialization mentorship actually helped us draft up an SBIR grant, which below in the potential, because we haven't been awarded it yet, is the SBIR grant that we applied for to further our phase 1 studies. So this was like a fantastic program, you know, a little bit of money in the bank, and, you know, it really was the first thing that we got as Zena Therapeutics. So it was, you know, a prideful moment. Further with that, we were awarded the Catalyst Voucher Grant, and this is a partnership grant with Rutgers University. So Zena and Rutgers will be working together, again, furthering this innovation, and this was provided by the New Jersey Commission on Science, Innovation, and Technology. They have a plethora of different grants. They have a matching grant. If you are awarded an SBIR phase 1 or phase 2, they match it, which is fantastic. So if anyone is in that stage of innovation, I would definitely check out their website to see what else is available that you may be able to apply. This Catalyst Voucher Grant is still open right now, and it's a rolling application. Further that, so moving a little bit more into the entrepreneurial side, Eileen and I are now Yale Innovation and Impact Fellows. And upon our successful completion of that, we are actually able to apply for a $60,000 innovation grant. And I believe that will open in January of 2023. And then lastly, and most recently, Team Zena won a pitch competition, the Audience Award winners at the Princeton Engage a couple weeks ago, which was our first pitch competition. So it was great to come out, you know, winning. We love wins. But again, like, these are all things that wouldn't be possible if we didn't have those networks that we found, like within Rutgers, within I-Corps, from New Jersey Health Foundation, and the mentorship that all of those different institutions provided to us. Eileen, do you have anything to add?
I think you did a perfect job.
Okay. All right, so moving on. So step 3, which is kind of our last step, you know, going from benchtop to business, is commercialization. Some of you might know what that figure in the background is, but if you don't, I will talk about it, maybe at length, hopefully not, but so let's move on to this. So to commercialize, that is the question. So what are important parts of commercialization, and finding out whether or not you want to commercialize or should commercialize. So first off, you need to validate your need, and validating your need is something that we really went like in depth through the 2 rounds of I-Corps and through the SUD startup mentorship. Is, have you defined your customer or your end user? Is there someone that's going to use your innovation, right? Because you need someone to buy it to make money so that people fund you to make it. Is there a worthwhile market? Okay, so, you know, you have an end user or customer, but what does the market look like? Is this a market that is less than $1 million? Might be hard to get funding if that's the case. Is it greater than $100 million? All right, you might need to go back and maybe scale back the market that you're entering. You might want to go for a smaller market, you know, so you're not such a small fish in such a big pond. Developing your value proposition. So is this oxygen or aspirin? And when I say oxygen or aspirin, this is like a common term in this space. Is oxygen, you know, we need it to breathe, right? So it's like a need. Or is it aspirin? So, you know, it relieves some pain, but you can get through without it. So you need to identify, you know, how necessary is this in the market, or how necessary is this for your customer and end user? And then lastly, what's next? So is this something you want to do? You know, Eileen and I, we started Zena with our founding members, Dr. Jacques Roberge and Jim Simon. Eileen and I came out of this straight from our PhD. So, you know, we're currently postdocs at Rutgers, but this is something that we're putting our all into, right? Like, we're not entertaining other job offers or things like that. We're focusing on just this innovation and just Zena. So this is something that is pretty scary. You know, you don't have a backup plan, right? Like, especially coming just from academia, you don't have a CV or a portfolio that you can like just jump into, you know, any kind of corporation and just be like, okay, I'm here, like this failed, whatever. Like, you really need to not just believe in it, but believe in it enough that you're willing to take this risk. And it's something that you absolutely need to think about ahead of time. Second is, do you have the team? So it is paramount to have a team that works with you. You want everyone in your team, especially when you're starting out, to believe in the potential, believe in the innovation, and you need to be able to have disagreements with these individuals and come out of the disagreements with a solution, not just giving into one another, but creating a solution together. And that is incredibly important and incredibly hard to accomplish, especially when you have different people from different fields at different, levels of seniority and different experiences. And lastly, so you do want to do it, you do have the team, but not every team has everything covered, right? So for example, like at Zena, as I mentioned before, Eileen and I don't have MBAs, we don't have a background in business, but we did take every opportunity and every entrepreneurship, mentorship that we've come across so that we can strengthen those things. And it's important to identify the weak points and whether you can strengthen them yourself, or you need to add somebody to your team to be that stronger link. So these are definitely important things to think about if you're going to, go from, like I said, benchtop to business. So as I mentioned, validating your needs. So identifying your customer. So with our 2 rounds of I-Corps, we did over 125 interviews. Yes, we called people, we cold called, we set up interviews. People didn't show up. People did show up. And it was kind of a wild ride, but we did it. And we interviewed hospitals, physicians, patients, rehab centers, individuals both suffering from anxiety, substance use disorder, or both. And, going through this experience, we saw that almost 90% of prescribers expressed concerns over this benzodiazepine overdose risk, over this fast-acting anti-anxiety medication overdose risk. So we definitely knew, through these interviews that there was a market and there were customers or prescribers at the very least that were eager for something that would, work as well as what's currently on the market, but with relieving those overdose risks.
Yeah, I was going to say, so when we started, we were targeting alcohol use disorder, which was the focus of my dissertation more. So during the course of the I-Corps, we pivoted to targeting anxiety, treating anxiety, a safer alternative, and potentially alcohol withdrawal may be a future market, but for our beachhead market. And this was really important because the market for a safer alternative to benzodiazepines was much more recognized, and it was a larger market. So and so these pivots were critical, not only to, shifting our business proposal, but also to designing experiments. So the sooner you can really start interviewing people and getting out there, and it's really just a process of trial and error, right? Like you're talking to people, like you have this idea, you think people are going to want it, but the only way to find out is to really talk to people, ask people, and also like this process really important is learning how to communicate your science. A lot of time in academia, I think maybe less so because we're more isolated and more used to technical terms. But when you're for entrepreneurship, you're going to have to be ready to pitch to broad audiences. So you're really going to have to learn how to explain what you're doing and why it makes sense. Because if people don't understand, they're not going to be interested. So you can have the best idea, but if you can't explain it right, it's not going to go anywhere. So you really have to, that's another process of trial error, really learning how to communicate what you're trying to do. And sorry, last thing is that I just want to say this process was really important for us too, because it really strengthened our conviction in the urgent need for this. So it really motivated us to keep going.
Absolutely. So market, what is a worthwhile market? So when we did, again, the SUD startup from NIDA, this was something, because their mentorship was really based on commercialization. This was something that, we had to look at and develop further. And one of our mentors, Elena, she had let us know that a market that's worthwhile should be between 10 and 100 million. Now, from my numbers here, it's not 10 and 100 million. It's a little bit higher, but that's kind of where, the baseline has to be, because people that are giving you funding, they want to see that they can recoup their money, with interest or with 10 times the amount. They want to see that they're going to make money back from investing in you and taking a chance. So as you saw the graphic in the beginning, we have these 3 nested circles. That's going to be our TAM, SAM, and SOM. So that is our total available market. So for us, the total available market is the global market for anxiety disorder treatments. And this includes SSRIs, SNRIs, and acute anxiolytics. And just to reference, acute anxiolytics are fast-acting anti-anxiety medication. The serviceable available market kind of brings it down a little bit more. And that's going to be our acute anxiolytics. So the global market for benzodiazepines specifically is a 3.35 billion and expected to grow to 4.25 billion. And then our serviceable and obtainable market is the market that we as Zena think that we can capture from the SAM. So right now we have a pretty conservative estimate that we would be able to obtain 10% of that market. And the reason that we chose 10% is because 10% represents those individuals most at risk for polysubstance overdose and polysubstance fatalities. And that would be our older populations. So older populations are at risk for these polysubstance overdoses because they may have been taking, let's say, a benzodiazepine like Valium, Klonopin, Xanax, since the 60s or since the 70s. And, you know, as they grow older, they may have, you know, some pain management regimens that include opiates. So when you have those two prescriptions together with someone with like a slower metabolism, there's a high potential for overdose with using those two. And of course, you know, our main target and, you know, the customer base or user base that really brought us to this innovation are those with substance use disorders. So they represent the 10%. However, you know, depending on the success and the success of Zena's innovation, the potential could very easily be the entire serviceable available market. So this is just something that you should, you know, think about when you're looking at an innovation, because it may not be the innovation that's the problem. You might have to just choose a different market. As Eileen said before, we were looking at alcohol use disorder. That was our main market. However, there was a broader market, and we could kind of touch more individuals at need if we expanded to anxiolytics instead of just staying at alcohol use disorder. However, you know, there's something called a beachhead market. So that's like the smallest market that you can get in. So that would be, you know, maybe benzodiazepine replacement therapy when someone's trying to get off of these acute anxiolytics, or individuals with alcohol use disorder. However, you need to keep in mind how much money that market brings annually, because that's going to cause you to pivot or shift what you're focusing on.
So during our mentorship, especially with the NIDA program, we developed our value proposition, which is really what with any technology or innovation, you need to really clearly define what your innovation is, how it will help and who it will help, and how it is different from previous, you know, from competitors in the current status quo. A lot of times, like in our case, the competition is the status quo, and people are very resistant to change from the status quo. So even though it might seem like there's no competition, status quo can be a very challenging competition. So our value proposition is our novel molecule, which will help prescribers who are trying to treat individuals with anxiety. And that want to ensure the safety of their patients, right? They don't want their patients to overdose or have severe withdrawal symptoms. So our innovation is different in that it can effectively maintain this fast-acting efficacy, but does not pose the same overdose risks as current standard of care.
Yeah, exactly. And one of the big things is, you know, in the bolded who wants to, like, that's your pain point, right? So what was the pain point that we saw in our prescribers when we were doing those interviews is a lot of them, like I showed before in those previous slides, 90% of the prescribers that we interviewed were concerned with these overdose risks. So that's what's considered a pain point for those individuals in this market, or in this environment rather. So entrepreneurship, training, and support. So, you know, you're going to go through this journey just like Eileen and I have and currently are, right? As an entrepreneur, it seems that it's kind of a unanimous that it's a never ending journey of learning, which, I mean, certainly piques both of our interests. So NSF funded Innovation Corps, this is where you're going to get some of your training. There's NIH funded Innovation Corps, which might be more specific to what your innovation is, whether for us it was substance use disorder or maybe the Cancer Institute, things of that nature. It's important to do your customer discovery, right? And that's how, and we were able to conduct our customer discovery in I-Corps with mentorship, but that's how you know what is a true pain point for your customers and who the customer is and where your market is and what the market very well may be. There's also accelerators that not only help accelerate like your innovation with research and development, but also with business development strategies. So for support, the entrepreneurship community, I mean, Rutgers entrepreneurs, we were actually at their inaugural networking event a couple days ago. And like I was saying, we were meeting people a couple steps behind us, a couple steps above us. And it was great just to not only receive mentorship from those who are a little further along, but to give mentorship, just like we're trying to do today with all of you, for those who may not be exactly where we are. And it's just a really, it's a really beautiful thing to create and be part of a community like that, because you really feel supported. And it's very challenging being an entrepreneur, especially when you have everything on the line. So it's nice to find that camaraderie that like, you're not the first and you won't be the last that's going to feel that. And, it's great to kind of give some relief to people and receive that relief. And
Ariane, if I just wanted to just say another few minutes, maybe 3-4 minutes.
Oh yeah, we only have one more slide.
Okay.
All right, so when you build those networks, you want to leverage those networks. And what is that? You're going to use those networks. You're going to need collaborations. You might need some of those weak points in your teams filled. And the best thing for that is when you're building a strong team, again, you need to identify the expertise you are lacking. It's okay. Nobody's expecting you to be able to do everything, right? But you want a strong team that can, or at least closely can. So when you have these networks, this is how you can maybe find people that fill in those different expertise. And other ways of networking, obviously through Rutgers alumni, entrepreneurship and fellowship programs, social media, and conferences. I can't say enough how important it is, not just for the alumni and entrepreneurship networks, but also going to conferences and creating networks from other universities, other spaces in the game, and seeing what innovations there are out there, what's like a hot topic, where's the market going, kind of getting a feel for that as well. Here's just like a little excerpt from our SUD startup mentorship, where we had like lead hipsters, hustlers, hackers, and on the bottom we have our founding members. On the left, Dr. James Simon, and on the right, Dr. Jacques Roberge, who have been so supportive and helpful in moving Zena from further along in our endeavors. All right, so last but not least, this is all of Team Zena. You've met me and Eileen. Obviously, Dr. Jacques Roberge, James Simon, Jennifer Buckman, and Nicholas Bello. I want you all to just pan these 4 other individuals and notice that they're from completely different areas of Rutgers University. Dr. Bello is in animal science. Dr. Buckman is in the Center of Alcohol Studies. Dr. James Simon is in the plant biology department, and Dr. Jacques Roberge is from the molecular design and synthesis course. So this is what Eileen and I are talking about, of don't be afraid to branch out. And something that's really like, a really special thing is that all 4 of these individuals were part of Eileen's thesis committee. So they've been along with us for the ride for the past 5 years, and they not only understand the problem, but they really see the merit and the potential of Zena's innovation, and we really could not do it without them. So just want to say thank you to our team, and with that, I will end and open for questions. Here is a QR code in the orange that will lead you to our website. On the bottom is our Twitter handle. We don't have a lot of followers. Please follow us. And then below our names are our respective emails. Thanks.
Thank you both. That was great. We do have some questions. And I would just tell everybody, if you do have a question, there is a Q&A box where you can submit your question. Somebody asked, what does the day-to-day look like at Zena Therapeutics? Is it something different every day at this stage?
Yes.
Yes, it's different every day. We don't actually have a location, so we're working part-time, and we're working at for Zena Therapeutics, but we're also, so like we go to the lab, we do work in Rutgers because we're collaborating with Rutgers for Zena Therapeutics, but every day is like completely different. We have like meetings, we have grants we're working on, like it's just the thing is, you just have to like keep moving forward when you don't know what to do. It's like, just do something.
Yeah, when Eileen and I have like any moment of like stillness, we're like, is there a grant out we could just like go ahead and apply for? Is there a fellowship? One of our teaching team members, Lori Dars from the Rutgers site, Innovation Corps, she'll send us emails, same with Bart Guzman, and just be like, hey, this thing popped up. We're like, all right, we're applying, whether or not we're far enough along, we're still going to apply to it. So yeah, it's a hodgepodge every day.
Somebody had a few questions. Did you publish your research before your patent? If yes, how? Did your PI already have an entrepreneurial spirit? Who owns the patent? And did you have any issues with that? What shares of the startup do each stakeholder involved have? And great job and keep it up, they said.
Thanks. So yeah, so we haven't published our data yet. I published my work for my dissertation on the natural product and some derivatives of that, but because of like protecting our property, the patent was recently filed. So we haven't actually published our compound yet, which I don't think ready to make that public yet. So there are different considerations when you're trying to, commercialize something. Sorry, what was the other question? That was a few questions.
Did our PI have an entrepreneurial spirit?
Yes. So we came from a very entrepreneurial lab. Like our dissertation, we got very used to working in this way. It's kind of like a hands-off student-driven lab in a sense. Like he's there, he's advising us, but it's more like you have to figure things out on your own. So it really got us comfortable in that space of like figuring out. And he's also commercialized stuff before. So that made me aware, like when I got the New Jersey Health Foundation, it was a grant. It was because he had previously gotten an innovation grant with another student that actually spun off a successful company. So we had the resources there.
And they asked who actually has the patent?
So Rutgers, I'm an inventor on the patent, and two of the advisors are, but it's technically owned by Rutgers right now until we finish the negotiations.
Okay, so in terms of which shareholders own which stake, is that still being worked out?
Yeah, so we have to go through like the term sheet and everything like that before we can clearly identify like what the shareholders are and things like that nature.
Yeah.
Okay. How did you come up with Zena Therapeutics? Where's the name come from?
So if you've ever Google searched any kind of name plus therapeutics, you'll notice that they're all taken up. Whether or not those companies are still running, they still own those domain names. So being that, Eileen and I are women scientists and women entrepreneurs, it actually came from a Slavic word, žena, which means women or wife in some interpretations. And I thought it was really pithy and I kind of like Z's. So we went with that.
Okay.
It's easy to remember too. So
yes, it is. Are your PIs working with you to continue Zena Therapeutic product development, or are you simultaneously working on separate projects?
So we work on a separate project, but they are also helping us like as much like in a limited capacity because they're full-time professors. But Jacques Roberge, we're collaborating with his lab with the CSIC grant we got. So he's really helping with that part. But we are also, we work on other projects a little bit, but we work like on this project. So I'm actually going into the lab, like making molecules. Ariane's helping me. So we're doing it together. We're gonna make more molecules. So it's a combination of both. You just basically you just got to do whatever you have to make it keep moving forward. So if no one else is doing it, you got to do it.
Okay. Are you open to hosting students for internships, mainly to learn firsthand about the operations and business side of Zena?
Yes, but we need to get like a establishment of like, maybe like we might be an incubator first. We don't know where we're going to be yet. So once the negotiations are over and once we officially launch, we definitely would be.
All right. Somebody asked, do you think there's an overdiagnosis of anxiety or depression?
Yes, I think in some capacity. Like, I think what we're trying to do is help people. Like, this is supposed to be a short-term relief where like a lot of times they put people on benzodiazepines and then they're stuck on them. They're very addictive. They can't get off of them, right? So this has like less of those withdrawal symptoms. It's kind of like it doesn't have that same, the maximal response is also associated with the withdrawal symptoms. So we don't expect it to be as hard to get off of. So a lot of times, the thing is, like, we're not necessarily just promoting like medicate everyone, but the reality is like benzodiazepines are really effective and people are going to keep using them if there's no other alternative. So unless we have something safer, like the devastating consequences of the risk, they're also going to be prevalent in our society unless there's an alternative.
Okay. How did everybody get connected on this project? How did you and Ariane get connected, and how did you connect with the other members of the team?
So I started connecting with the other members on the team during my dissertation work. So I was trying to turn like a side project into my dissertation. So I was just constantly reaching out to professors, finding someone who was, interested enough to help me. And it's really like finding other people with the same interests, someone who actually cares also, who will be wanting, because there's a lot of professors that don't want, everyone has their own stuff going on, and so it's not always easy.
Yeah, and Eileen and I were both in Jim Simon's lab. We were at the same place, and this is actually a funny story. We were at the same place. We were sitting back to back in the office, we were trying to do one thesis chapter a week. So we were writing our theses, and we were like passing the laptops together in like our spinny chairs and like reviewing them and sending them to Jim and like our own thesis, like our own committee members. And one day Eileen was like, "Oh, Ariane, I'm gonna do this thing called I-Corps. Would you be interested? You don't have to, but it could be fun. You're gonna learn tools anyway. Just because we're doing it anyway." And I was like, "All right, sure." And then here I am. which is the great, like a really good characteristic of a founder is being able to identify co-founders that you would work with well, right? So like if you think about like the difference between like founders and co-founders, founders like Eileen like have the idea, and then they find individuals, especially early in the beginning, which would be co-founders, to help execute this vision. So thanks, Eileen.
yeah, exactly. And like that's what I recognized in her, was a similar like work ethic as me. And she also really cared about addiction and understood the problem. Like we were discussing my project for years, and like so I already knew she knew, and it's something she cared about. And I knew she had like we worked well together. So that was like really good, a good match. And it's so important to find team members that you can work together with. I know like most companies, like there's a lot of investors that are really scared of founders having disputes, because that actually ruins a lot of companies. So it's really important to be comfortable with, your team.
Absolutely. Are you looking to expand your business? If so, what areas of expertise are you finding additional need to progress?
Ariane, do you want to take this?
Yeah. So when we have money, and I use when because I am optimistic and realistic. But so when we have like, our own, like when we move maybe out of Rutgers and we have our own like sector or area, maybe an accelerator, our own business, we definitely want to take on very slowly, because, as I try to reinforce or prove the point of in the presentation, is that like this is scary. It is like your life on the line kind of feeling when you're embarking on an endeavor like this. So we want to slowly bring people into the business. I think Eileen and I talked about thinking about somebody in business development or administrative, perhaps like a part-time chemist starting, but we want to make sure that we have the funding and we have the facilities so that we don't bring people into this that aren't ready for it. We never would want to have anyone like part of the team that felt like it felt uncomfortable, rather, like, to be honest, like uncomfortable or insecure, like especially in funding and in their job security. So yes, but not right this second.
Okay.
Unless someone was willing to join us without money.
Yeah, that's on you, but you're more than welcome.
Do you anticipate moving beyond anxiety or SUD? If so, how would you look to accomplish this? Companies like Sage and Marinus have utilized GABA modulation in indications such as MDD and seizures, respectively.
Yes, definitely seizure disorder is something that we are considering. Because like, I mean, there's a lot of children who are taking benzodiazepines currently because that's the only thing like that is like really, it's effective in seizure disorders. So this is definitely something we would consider as a future option.
Okay. Is there anything you wish you knew before you started?
I don't know if it would have changed anything.
Yeah.
Because I feel like you just have to keep, like, you just have to do it. Like, I don't know. And maybe it would have like tapered our enthusiasm if we knew how hard it was going to be. I don't know. Maybe I can't think of anything.
Yeah, I mean, like, to wish something had gone different would be like to remain ignorant in the process, if that makes sense. If it's like, oh, I knew like, this type of funding I'd need instead of like living through it and going on the journey, I think would kind of, mitigate kind of the learning process within itself. I mean, we're still new too, so I'm sure like, ask us in 5 years, I'm sure we'll have a plethora of things to share with you. But as for right now, I mean, I wouldn't really change anything either.
I would say one thing that I learned from the NIDA program that I think could be useful to people was like really like, because in that program they helped us like write our next like SBIR grant, but she really like demonstrated like how much the reviewers are looking for a specific thing, and you have to like word it exactly, like, just to help like really spell it out for them, because I didn't realize that. And I feel like we wrote like so many grants with kind of like assuming that they would pick up on things, but like they're super busy, the reviewers, they don't have the time. Like you have to really spell it out for them. So just maybe knowing that would have been very helpful.
Yeah, to add like very briefly to that, and when you're coming out of graduate school, like you want to use the jargon and kind of demonstrate your own merit, because like Eileen and I, have not been like full bird professors, like distinguished professors, like the people on our team. So we realized that actually that was the worst thing you could do. You should be able to explain, maybe even pitch to a child what you're doing, and like to somebody that, maybe does something else as their occupation or career. Like you should be comfortable with making it incredibly simple instead of trying to demonstrate your merit or worth using more complex language than you actually need to.
Yeah. What advice do you have for students aspiring to go to grad school and eventually end up in the pharmaceutical space?
Do you want to make money? There's multiple paths, but if you want to make money, right? If debt and, having a lucrative job are important, then you should, definitely look at what the space is moving towards. Like, so for example, like when I had first started, like later in my undergrad, like CRISPR-Cas was like a really big thing. Get into a lab that does that, because by the time that, and like try to find a place that's doing something cutting edge, because by the time you graduate, you will have a job market that absolutely needs you. However, if you're like Eileen and I, and you have your own ideas and like the only things you want to, like you have things that you want to do that may not be, immediately lucrative, but it's something that's important to you, which, you can have both. It's just, I'm just trying to make like two extremes, just for example purposes. Then you might want to look for a lab like, Dr. Simon's, where it's kind of, Jim, forgive me, a free-for-all. And it is like student driven and very like entrepreneurial based, but you are kind of, if you want to do it, he will absolutely co-sign it, but you have to get it done. You have to find, collaborating resources for that. So, like think about, just like the first kind of thought exercise is, where do you want to be in 10 years from now? Like what ideally, like what do you want for yourself and what do you want as your environment, and then go from there. Because like grad school is not necessary. You can get the things that you want and, that are important for you from other things. You can get like certification programs, things like that. So just have like a a self-talk with like what you want for you and what you want for your environment.
Yeah, yeah. And I think also like because maybe some people don't know yet, like if you don't know what you want, I think it's important to really pursue what you love, I think, and like your passion, and you can kind of find or like towards a problem that you're interested in solving, like we said, but like just being open. Like if you don't know, just like open to new experiences. Like if you go to grad school, probably like you might want to transition through a few labs, do like rotations to really see what's out there first with just an open mind to really like help make your decision. But yeah, I mean, I guess like if you're saying like in the pharmaceutical space working for pharma, you want to get like that experience specifically, or whether you want to do an entrepreneurship space. But I think it's just really important to just like, be open to all new experiences, take every opportunity.
Okay. So this is a good one to end on. What are your next steps?
So we're waiting for the license negotiations. We're waiting for the SBIR. And then like so that once that's through, we're going to launch our company and we're going to go full force into like 100% Zena Therapeutics, where we have an actual location, and really just advancing this. We're in the optimization stage, so we're making more molecules, and just as quickly as possible, we're working on identifying our candidate molecule.
Okay. Well, that's all the time we have. I think there might have been a few other questions. Like I said, we'll send a follow-up email after this event, and you'll have contact information for our two presenters if you have any further questions for them.
Yeah,
so thank you both very much. Great presentation. That's Mary, do you want to chime in?
Just to thank everyone for the presentation, Eileen, Ariane for the presentation, and for everyone attending. We will see you back in the spring with our spring 23 science cafes, and wishing you a good end of the year and a successful start to the new one.
Thank you.
Happy Thanksgiving.
bye everyone.